Hi, it's my pleasure to introduce you all to one of my favorite people, Jackie Fairweather, who is a fully qualified and licensed acupuncturist and a sports science graduate. She runs a successful clinic treating many conditions, with her speciality being in women's health issues, because God knows we have enough of them. Tonight, her focus will be endometriosis. So everyone, please mute yourself. And any questions you have, put them in the chat and we will address them in the end. Thank you for so much for being here, Jackie, and it's all yours. Take it away.
Thank you very much. So for me, the purpose of this isn't to baffle everyone with science. It's not to be super science or go deep diving into it. For me tonight is about giving information. It is about making sure the information can be taken away and put into everyday life. Because what I'm finding is the transition from the deep dive science to putting it into practical measures is where we get lost. And women who are diagnosed with endometriosis or adenomyosis, they can get a bit lost in this all, and it is a bit murky at times. I personally had endometriosis. I say had because I'm post-menopause now, so I haven't got it now. I will probably touch on my story a bit later as it winds through. But suffice to say, for me, endometriosis was blooming awful. I'm just going to try and fix that because I've still got people on the side. There we go. So that's me. I will start working through. Oh, the other thing I want to say, this is actually quite slide heavy. I don't normally do this, but I've done this so people can take pictures when you're watching the recording. There's a lot of information. I had to get rid of a load of information that I thought people might need, and I will verbally do it. But there's lots of little cues for you to go and Google, PubMed, or wherever you want to look for it. You can find more information, but that's why it's slide heavy, and I'll probably hover around some slides, and it's quite wordy, but I don't think you do these two things justice without it being wordy. So that's why, and just please take pictures, or, watch the recording and take pictures, freeze it, do whatever kids do these days, crazy kids that they are. Okay, so let's move down. She says, why won't that move? Why won't that move? There you go. So this is me. I've had 34 years in the health and fitness industry. As Shivvy said, my degree was in sports science. My second degree was as an acupuncturist. My speciality is women's health. I think because I struggled so much with different issues, fertility, endometriosis. I'm sure there's more chucked in there. I'm a mother of 2 and a grandma of 1. I had to add that in my last slide. I didn't have grandma of 1. I was told I wouldn't be able to have children, and due to endometriosis and other reasons. My whole purpose is to help enable people to reclaim their health, wellness, and fitness. That is my purpose. This is what I want. I want to give people information they can use in everyday life. This is Chinese medicine. If there is a pain, there is no free flow. If there is no free flow, there is a pain. I'm not going to read the Chinese. I haven't done Chinese for a while, and I don't want to do it in disservice because of the way the accents work. But basically, we have, in Chinese medicine, endometriosis is rooted in stagnation, liver qi stagnation, blood stasis, cold in the uterus. But it's all about the fact of the flow. And, the reason that picture is in a circle is that's representing a cell. And this is absolutely about the free flow in and out of every cell in our body as well. And when we're talking about omega-3 and we're talking about Zinzino, we're talking about flow around the body. We're talking about the gut working properly. We're talking about the nutrients being absorbed, and we're talking about the cells working properly. So for me, I thought this quote was a really good one to have right in the beginning, just to make you kind of get in your head, a period should flow. If it doesn't flow, if there are clots, if there is pain, it's not free flowing. The clots mean something. They can mean stagnation in Chinese medicine, but they shouldn't be dismissed because they mean something. Okay, let's come down to this bit. Oh, it's gone. There it is. So these are facts and figures. Again, please take pictures of this. I really want to minimize this. There we go. So endometriosis, I'm going to read them in case anyone's listening to this rather than watching it. 1 in 10 women have reproductive age in the UK suffer from endometriosis. What an awful statistic. 10% of women worldwide have endometriosis. That's 176 million. The prevalence of endometriosis in women with infertility can be as high as 30 to 50%. That does not mean you can't get pregnant having endometriosis. Endometriosis is the second most common gynecological condition in the UK. Endometriosis affects 1.5 million women, similar to those affected by diabetes. On average, it takes 8 years from the onset of symptoms to get a diagnosis. I can guarantee you anybody on this call who has endometriosis will have had a fight and a struggle on their hand. Even more with adenomyosis, especially if they got it when they were young. Endometriosis costs the UK economy 8.2 billion a year in treatment, loss of work and healthcare issues. I raise a question. Why don't we use all the preventative health that we've got out there? Why is the economy being this affected? Why are our work days being lost? Why are women on sofas doubled up with hot water bottles? It's an absolute disgrace when you look at these statistics, why we are not being looked after more. So I'm on a bit of a mission with lots of women I work with to make sure that we do get this highlighted and that we do, not for other people to help us, that we know we can help ourselves. We can make ourselves better. There's so much out there we can do, but it's just not talked about. Adenomyosis, 1 in 10 women of reproductive age in the UK suffer from this. Teens and young people are not too young to have it. Adenomyosis is as painful, if not more painful, than endometriosis. Hormonal therapies do not cure adenomyosis. The cause of endometriosis and adenomyosis is unknown and there is no definitive cure. I mean, I know, well, they say it's unknown. I'm a massive believer in that inflammation is the absolute driver of this. You can get endometriosis and adenomyosis at the same time, which is just wrong. But shared symptoms you might have heard of. Both conditions have overlapping symptoms like pelvic pain, menstrual irregularities, oh, I can't say it, fertility issues. This can make it challenging to differentiate them. The coexistence of endometriosis and adenomyosis is not uncommon. Some studies suggest that the woman with one condition might have a higher likelihood of getting the other condition. However, diagnosing both conditions is challenging. It is really, really challenging to actually diagnose this, and I will come on to that later. When endometriosis, oh, that went, and they did that, and adenomyosis coexist, their combined impact can exacerbate symptoms, leading to severe pain and menstrual irregularities. So there's some facts. So when anybody comes with you and says, I've got endometriosis, you can actually look at what is endometriosis. I found some other interesting things out. The top line I knew. Endometriosis is a condition where tissue similar to the lining of the uterus called the endometrium grows outside the uterus. Fun fact, every time me and my daughter both suffered with endometriosis, luckily I've had the knowledge to pass on to her, so she hasn't had the symptoms as bad, yet she still does suffer with it, even when we're doing everything we can possibly do. However, and it's an interesting symptom, and when I was researching a bit deeper into this, she gets nosebleeds at her period. And the endometrium, well, the implant of it can wander off and go into the nose and cause nosebleeds. Who knew? Because I was chatting to her, and also it can go into the lungs, and some women can feel breathless around their periods because that's what's happened. The endometrium has wandered off and decided to stick itself there. And then it gets inflamed around the time of the menstrual cycle. The displaced tissue can cause pain, inflammation, and form adhesions. Very, very close to my heart, that, because the adhesions I had completely encased my ovary. So I had to have my ovary and my fallopian tube removed, and it stuck my bowel to, it stuck everything. So it was all round my bowel. It was quite a nasty mess in there. The symptoms often include pelvic pain, heavy or painful menstrual bleeding, pain during intercourse, and fertility issues. This is the really interesting bit, especially for when we're talking about omega-3, we're talking about cells, we're talking about how we can help. This is what I want us to take from this, how we can help. Endometriosis happens at a cellular level. The endometrial implant attaches to the cell wall and hangs in there for dear life. The important question to ask is something in the body weakening the cell membrane? Is this because the cell membrane is hard and rigid, not soft and permeable? Is it because there's just not the right level of essential fatty acids in that cell? Is that what's happening? All I know is we need to keep our cells healthy. We need to bring down inflammation. So is the weak cell membrane why the implant's taking hold? And importantly, how can we maintain the integrity of our cell membrane? Well, that's exactly what we're going to do, or we're going to try to do. And knowing how our cells work will help us strengthen our cell membranes. Essential fatty acids help keep our cell membranes strong and permeable. What you need to remember is whenever we talk about essential fatty acids, omega-3 is not a supplement. Omega-3 is not an addition. Omega-3 is a vital nutrient in your diet. You should be able to get it through food. Mostly we can't. We supplement it because we can't get it. That's the problem. So when people say to you, I don't need that, it's just a supplement. It's not just a supplement. It's a vital nutrient in supplement form that we need, desperately need, especially us ladies suffering from this. So the symptoms of endometriosis. Now you've got the sharp, deep pain during ovulation, sexual intercourse, bowel movements, and or urination. I've spoke about this many times, and me and my daughter always talk about the poo pain. There is a particular pain you get when you're passing a motion, and you almost have to hold on to let that motion pass, and then you can breathe a bit. Because what's happening is, as everything's inflamed, your bowel is restricted, and it's really painful going through. I think that's what I get a bit emotional about this. I think it's underestimated, and it's told, oh, well, it's a painful period. Even if it is a painful period and not endometriosis, periods shouldn't be painful. This is a misconception. It's become normalized. It isn't normal. It might be usual, but it is not. You should have pain-free periods. Menstrual irregularities, heavy painful periods or bleeding in between periods, fatigue. You can get very, very tired with endometriosis. Indigestion, diarrhea, constipation, nausea. I can explain more of this with Chinese medicine. I won't. There might be Chinese medicine practitioners on here. I might dip in and out of that. But as I said, I'm trying to give you tools to take away. So if you're chatting to women and they come up with any of these symptoms, you can go, oh, I wonder if this is how I can help. Infertility, but as I said, you can get pregnant with endometriosis. Please don't be scared off by that. Back pain. There can be referred back pain. And then if you look underneath, headaches, allergies, respiratory issues, although these are less common, and the nosebleeds. Who knew? Well, I did, because I found out. Okay, causes and risk factors. So you've got retrograde menstruation. So retrograde menstruation there's a bit of a challenge on this at the moment, because people are saying this isn't a thing. So you've got a bit of a mixed bag. So you might want to look at the weight of the different research that's out there. But I put everything on here that they think it could be. So retrograde menstruation is when, instead of the period blood coming out, the period blood pops back up the fallopian tubes. And because there might be some bits of endometrium in there, they attach where they shouldn't attach. So that's the problem with retrograde menstruation. You've got embryonic cell transformation. Another theory suggests that embryonic cells lining the pelvic organs transform into endometrial-like cells, and then during puberty they pop off other places. All of these can be looked into deeper. I just wanted to give you an overview. Surgical scars. Now, so you've got where the scar is, you've disrupted all the tissue, and then you can find the lovely endometrial cells or implants want to wander off, and they find this beautiful place to sit. And you've got pain on top of that with the scars anyway, because it is a disruption. Rub some what's it called, Revo on it with some of the skin cream, skin serum, that helps. And a moxa stick, that hurts. A moxa stick. Sometimes when I say it, people think I've said a moxa. Immune system disorders. They are thinking there's an immune system connection to this, where the immune system fails to recognize what the endometrial implants are, accepts them when it should be getting rid of them. Hormonal factors. Is there an estrogen issue? They don't think estrogen actually causes it as such, but there is a problem with estrogen driving it. So we are going to talk more with Marta later about that, because Marta can go a bit deep diving in there. But basically, estrogen, a hormone involved in the menstrual cycle, may promote the growth of endometrial tissue outside the uterus. Endometriosis often improves during pregnancy or menopause when estrogen levels are lower. Well, I can quite honestly say from my point of view, menopause has been lovely because I don't get that anymore. But had I known what I know now and knew it when I started my periods, I don't think I'd have had all the suffering and pain I'd had anyway. I mean, the heavy bleeding, when I'm talking heavy bleeding, you stand up off a chair and it's covered with blood. That sort of heavy bleeding, even though you've got a pad on. You know, these are not funny conditions. These are not just, oh, they got endometriosis. Oh, you know, well, actually, nobody says that about adenomyosis because most people don't understand it. But with the endometriosis, it's a bit taken for granted because everyone talks about it, but it shouldn't be because it's a really devastating problem. Now, genetic predisposition, I'm not sure about genetic, as in mum's got endometriosis, so you have. But I do believe if you've got inflammation and then you give birth to a child with inflammation and then that never gets rectified, and then the weakness might be around that area, they may get it. I don't know the exact research and science into that, but I do know Beth has it. Is it because I've got it, or is it because I passed inflammation down? I can't do anything about the genetic thing. I can do something and teach her about the epigenetics, and let's not do the stuff that might turn on the endometriosis. And I can blooming well help her reduce inflammation and make sure her body is as healthy as possible. So you've got environmental factors. So dioxins, I wanted to read that to make sure I got it right, can increase the risk of developing endometriosis. So anything, you know, we all know about these chemicals and toxins that are getting into our body now. They're endocrine disruptors, they're causing havoc with hormones, they're raising estrogens. So again, I've put this here because there is discussions around it. I don't know. Let's see what the research says. But these are all things to consider. And when we're treating women in our clinic, we will always talk about the environmental factors and say, right, what you're putting on your skin, what's in your home, what's in your environment. Reduce all chemicals. Make sure you've got a good environment you're living in. Inflammatory factors, which of course we're going to be very strong on because we know we can absolutely do something about that. Inflammation within the pelvic cavity may promote the development and progression of endometriosis. This is all kind of may and what. All I know is from my anecdotal evidence, when I give everybody a full holistic treatment with the right supplementation and treatment, it reduces, the pain reduces and everything reduces. So from anecdotally wise, that's why I'm talking about all these things today. Okay, conventional treatment, again, I know it's wordy. I'm sorry about that, but it needs to be wordy, unfortunately. I'm going to briefly go through these. You can look up them if you want. The conventional treatment of endometriosis aims to relieve symptoms, reduce size and spread of endometrial implants, and improve quality of life. You know, it can do, it can't, you know, women are given laparoscopies and can cause more scar tissue inside. Will that exacerbate the symptoms? Again, it's very difficult to know, hindsight, and are we looking inside the woman's abdomen? But the conventional treatments of endometriosis are always pain medications, anti-inflammatory. So in my brain, I'm like, well, if you're giving anti-inflammatory drugs, why would you not prescribe an anti-inflammatory diet and omega-3, which are anti-inflammatory? This is where I think we're missing a trick with some of the Western medicine approaches. You're given birth control pills, which does not cure the cause. All it does is suppress the symptoms, hopefully, and often it doesn't, and can cause problems further on for the girl because she's already hormonally got issues. Progestin therapy, you know, let's boost progestin. Let's try and make sure you're not having a period. They do that, and that's not healthy either. It's got to get to the bottom of it. GnRH agonists. So basically they work at temporarily suppressing ovarian hormone production. You've then got your surgical intervention, your laparoscopies, your laparotomies, and your hysterectomies. A lot of women are pushed to a full hysterectomy. I actually spoke to someone earlier who was saying that someone didn't give her, they left their ovaries, and she went, oh, I wish they'd just taken everything. Well, actually, the ovaries still release a tiny bit of estrogen. So, keep hold of as many organs as you can. Not if, you're in absolute agony and you're bleeding out, but try and keep your organs for as long as possible. Fertility treatments are given, and then pain management strategies. Anyone with really severe, we all know the mind is powerful. We all know you can use your mind to help with all sorts of things. But when I was given cognitive behavioral therapy to help me with my pain, it didn't really touch the signs because I was in quite a lot of pain. So it didn't really work. It may work for some. This is what I wanted to tell everyone, though. Currently, women are being told there's no lab test procedure or imaging that can be done to diagnose endometriosis without surgery. However, there is talk of using MRI combined with ultrasound technology to diagnose without surgery. And I know this is being done and can be done, but obviously there's a cost. So I'm hoping the next generation of women can get this diagnosis without having to go through laparoscopies, which are not fun, especially if they start removing things. Okay, adenomyosis is a condition in which the tissue that normally lines the uterus begins to grow into the muscular wall of the uterus. This can result in enlarged uterus, heavy menstrual bleeding, and pelvic pain. Adenomyosis can coexist with other conditions like endometriosis, and its exact cause is not fully known. Okie dokie. So symptoms, it's very similar symptoms. You've got heavy menstrual pain and heavy bleeding. You've got your pelvic pain and enlarged uterus. And what they found with the adenomyosis, you don't just get a bit of it enlarged, the whole thing seems to be enlarged. And the pelvic pain is far worse with, and apparently is a hallmark of adenomyosis. So if someone's got pelvic pain, severe pelvic pain, you might want to ask them, okay, what's going on here? Abdominal discomfort and painful intercourse, you often find with endometriosis or adenomyosis that there's painful intercourse. So that can be a sign as well. Not necessarily a diagnosis, but it can be one of the major signs. Urinary symptoms, that's what I wanted to talk about. In some cases, it can lead to urinary symptoms such as increased frequency or urgency, particularly during menstruation. So that's another one to look out for, because I think a lot of girls and women are wandering around with both of these, not really knowing they've got them. So I think we need to educate ourselves, educate other people, whether you want to send people to functional medicine doctors or lifestyle doctors that are really coming into force now, or their actual doctor to find anything out. That's totally, and it's totally up to the person as well. It's what they need and what they want to help them. What we're trying to do is understand the conditions. We're trying to give advice, and we're also trying to work out how we can help and who best to direct these people to, because nobody knows everything. There are going to be people on this call that know far more about these two conditions than me, and maybe people that know far less. There's going to be a big mix. Anybody that's got endometriosis will have done a lot of research on endometriosis, because, it's not fun. It's not fun in any way. And back pain again. So they're very similar to endometriosis, which is why adenomyosis gets missed a little bit. Causes and risk factors. So we've got hormonal factors. So we've got our, where are we? There we are. It's thought to be influenced by hormonal factors, particularly estrogen. High levels of estrogen, either produced by the body or taken exogenously through hormone replacement therapy or birth control pills, may stimulate the growth of endometrial tissue within the myometrium, which is that muscle wall. So this one more so, hormonal factors seem to play a bigger part. Childbirth, because of the way the uterus stretches and because it goes back and there might be some scar tissue, the cesarean, you don't know what sort of damage has been done in there, and that might lead to the endometrial implants being able to whip through that muscle lining and start forming in there. Uterine surgery, anything, and you've got scar tissue going in. So procedures that involve the uterus can disrupt the normal architecture of the uterine wall. I'm reading this because I want to make sure I get it right. Potentially allowing endometrial tissue to implant and grow within the muscle layer. So you have to think about all the things that have disrupted. So when you're talking to somebody who's telling you about their issues, make sure you're really listening to what actually has happened to them. And you might be able to go, oh, I think I know what that is. Hormonal imbalance, inflammatory factors, because it is inflammation. And if the body's inflamed and not healing and not calming, we need that. Age, but you can get it when you're younger. Again, you've got the genetic factors, you know, dry throat. So you've got the genetic factors of, is it passed down? Is it something that we are passing down through our genes? Again, there'll be lots of research on this. Endometrial stem cell theory is interesting. Some researchers suggest that adenomyosis may arise from the presence of stem cells in the uterine lining that can differentiate into both endometrial and myometrial cells. These stem cells may migrate into the myometrium and develop into endometrial tissue. That was a new one on me. So I was like, well, that's interesting. And then again, you've got the immune system disruption that we were talking about. They don't know the exact mechanism of that. They don't know exactly what's going on. Please take each of those titles, link it with adenomyosis, and have a really good look for yourselves as well if you want to really educate yourself in that. As I said, I'm trying to do a really simple overview for people to take away. Conventional treatment for this is pain medications, hormonal therapies, which don't work, uterine artery, I'm going to say UAE, embolization. I love it when they have big words I can't say. It makes it so much fun. So this procedure involves destroying the lining of the uterus to reduce menstrual bleeding. While it may provide relief from heavy periods associated with adenomyosis, it is not suitable for women who desire future fertility. And it's a bit harsh, really, isn't it? If we could possibly prevent all of that and allow women to live a full, happy, pain-free life without any of this, I think that would be great. So you've got your hysterectomy again, which they quite like doing, your endometrial ablation. I'm not saying some women don't need it. Each of us is an individual and we work out what we need. What I'm saying is, I think there may be lots of steps we could take before we get to these. Endometrial ablation, so basically you're firing away the lining of the uterus, and then pain management strategies again. So here we go. Supporting endometriosis and adenomyosis naturally. I realize I'm halfway through and I need to talk about this bit. Omega-3 fatty acids found in algae, wild line-caught fatty fish, flax seeds, walnuts, they all exhibit potent anti-inflammatory properties, potentially alleviating pain and symptoms associated with conditions like endometriosis. There was a lot of research on this. Please look, I haven't listed all the research papers, but there are, and I think everybody on the vaults has got them, and anybody who's a customer or an interested party, go to whoever invited you here and we can get you more information if you need it. The crux of it is omega-3 reduces inflammation, has an anti-inflammatory effect, which will help endometriosis. Vitamin D is crucial for hormonal balance. So vitamin D is something I will always recommend for women to have a vitamin D test and then take vitamin D to support their hormones and their immune function. Because as you've heard, both conditions, people, scientists are saying might be caused by immune issues. So let's make sure we've got a strong immune system. Dietary fibers. You want to make sure you've got good gut health, not gut dysbiosis. You don't want what are they called? Estrogens going back into the body through the gut. You want to make sure the gut's healthy as possible. You want to make sure your bowels move as healthy as possible. Especially, you definitely don't want to be constipated if you've got endometriosis and you're due on your period. Or on your period, that's for sure. So you want to make sure you've got all that flowing back to the body flowing. You want your body to flow. This is, it does help regulate blood sugars, dietary fibers, and making sure you're getting enough of those, and that stops blood sugar spikes, and then comes on to PCOS and PCO. You can have one without the other of those conditions. That's not what I'm talking about here. I am going to do another one of these on those, because I think it's just as important for us women to understand that and be able to help and support each other and encourage each other. Just little snippets of advice can change a woman's life. Just one comment said to them and one thing that they can do. You then want a multi-immune food supplement to encourage the innate immune response and restore vital micronutrients and minerals. Now, the reason I say all this is because you want the foundational health in place. Get the human body back to its as healthy as it can be in where it is now. If you're 90, you're not going to be like you're 20, but let's get your body into the best state possible. Let's give it what it needs. You don't put petrol in a diesel car. So let's put what our body needs to fight any of these things. And, you know, feed the mind, you know, feed the brain, make sure that we're in a good state in our brain, you know, with our sleep. I come onto all that actually. I'll stop blabbling about that. Collectively, these nutrients form a foundation for women's well-being, promoting hormonal balance, immune support, and overall vitality. Integrating these essential nutrients into a balanced diet can empower women to proactively manage and support their health. I'm all about taking control of your own health. We have unfortunately got a bit lazy with looking for help on the exterior and expecting something to help us, as opposed to going, okay, what can I do? And then really taking power of that. It's very empowering when you go, oh goodness, I did that. I stopped that. I helped that. So in my clinic, I do work with Zinzino as well as other things, but with Zinzino specifically. And the reason I do is because we know the balance oil works. We can test and retest. We know the science behind the other products. We know they're all natural. We know the body can absorb them. So when I have a patient with either of these, I will put them on, let's move to this one. I will put them on what we call, this isn't the only solution, it's part of the solution. I will put them on what we call the health protocol. So we want to balance, we want to get their cells back in balance with the oil. We want to restore their gut with the biotic. We want to boost with the good immune support supplement, and then vitamin D. You want to have some vitamin D. But if your vitamin D test comes back and you're very deficient, you're going to have a very different discussion. And you're going to have very different discussions around all of this. But I would say get yourself tested. Find out your inflammatory levels. Every endometriosis woman I've treated has really high omega-6-3 ratio and inflammatory markers, me included, considering I shouldn't have had slap wrist. You know, sometimes we can't see our own stuff, can we? You can tell everyone else what to do or advise everyone else, and then you look at yourself and go, oh, I should have done that. Oops. Okay, these are additional ways to support endometriosis and adenomyosis. So you maintain your balanced diet. Again, I know it's wordy. Prioritize whole foods. Consider the not consider the anti-inflammatory diet. Do an anti-inflammatory diet. Ensure adequate intake of essential nutrients. Now, years and years ago, we used to eat about 6,000 calories a day because we were so active. With the whole culture we're in and with how females act now, we're expected to have 1,500 to 2,000 calories. You cannot get enough nutrients in the body that your body needs to successfully thrive and navigate hormones and the female cycle. So the only way to do this is with clever, very clever nutritional supplementation, and you just can't get it from your food now. Our food isn't nutrient dense enough to get it. Unfortunately, it's calorie dense and not nutrient dense. That's a whole nother presentation, but just know that we do need to supplement in this day and age, but you not just anywhere. You need to get really good advice, and you need to find out what is going to work the best for you, and it needs to be natural, no bulkers, fillers or emulsifiers in it. Regular exercise, this is vital for these conditions because you're trying to stimulate, for Chinese medicine, movement around the body. You need the movement. You need to boost all those happy hormones. You need to get yourself feeling good, reducing stress. Stress is not great for inflammation. We're talking all about food, but stress rises inflammation in the body. So we also need to be very mindful of stress. Where weight management, yes, but if you're doing weight management, I want you to think about why you're doing it, what you're eating for. It's not about, I want to be thin, I want to look thin, I want to do this. It's about, I need my body to be at a healthy weight to maintain all the healthy systems. I'm definitely not an advocate of dieting as such. Stress management, practicing stress reducing techniques. I mean, goes without saying, let's bring that stress down. Let's go to some womb healing yoga. There's plenty of that out there. There's lots and lots of avenues people can go to that can naturally help. Sleep. Now, there's research out at the moment where this whole thing that it's 7 to 9 hours sleep, it turns out most of this research was done on men. Actually, women probably need about 8.5 to 9 hours sleep, not that 7 hours sleep. And the way the 40-hour week works isn't conducive to women either, because that's about how men work, and that's how that was set up. We have a monthly cycle, and we should honor our monthly cycle with taking the most of being creative when we're ovulating, and taking the most of being calmer when we're about to have our menstrual cycle and progesterone's rising. We have a beautiful system that hasn't actually been honored in the work world, or in the world we currently live in this modern world, because we're all trying to fit in to how males work. And I think this is all coming out now. There's more research about it, and if you keep an eye on it, it's quite interesting. They didn't know this, we didn't know this, but actually we are very different beings, and we should be treated very differently. Hydration. Stay well hydrated, absolutely. You just want to make sure you've got enough fluids in the body. Add electrolytes if you want. Herbal remedies that are recommended are Agnus castus, dong quai, and ginger. These are really good for helping with inflammation. Acupuncture, I'm going to say acupuncture, aren't I? Obviously, acupuncture is the best. To be fair, it does work. And using moxibustion is really good, and heat. So we work with a lot of this. My daughter and I do a lot. Beth does masses of work with endometriosis. Epsom salt baths are great, maybe with a couple of drops of lavender. Castor oil packs on the area are brilliant. So if you can get yourself, I do have a link. It's not on here. I have a link to a particular brand. I didn't want to put it on here, but I will share the brand with people. There is a particular brand where you just put this on you overnight, and it really helps. And minimize exposure to environmental toxins such as endocrine disrupting chemicals found in plastics and pesticides. We are under attack from all of this. We're living in a modern world. We're going to have to live in a modern world. We're going to have to exist like this. You can't get rid of it all. As much as we'd all love to live in a blue zone somewhere, we don't, but we can create a blue zone in our home. We can do as much as is possibly in our power, and we can certainly create a blue zone in our body and make sure we're only putting in our body what our body needs and wants. Actually, not wants, because someone will go, I want a chocolate cookie. I know what your body needs. Okay, I've got some additional notes from Marta, which I'm going to read through. Any questions on these? Marta is on the call, and we can answer them afterwards. But from Marta, she's saying, identify triggers, inflammation, poor gut health, any nutrient deficiencies. Is there abnormal immune function, higher levels of inflammation? In addition, the immune system doesn't clear up the lesion, but promotes their growth with inflammatory cytokines. As I said, an anti-inflammatory diet is a must for blood sugar balance and to control insulin. EPA is essential for pain management. We must test omega-6-3 ratio, omega-3 index, and vitamin D levels. Iodine testing is also advised. To normalize immune function, start with the gut. Test microbiome. Improve your gut health and immunity, detox pathways, and the liver. If you have poor gut health, i.e. dysbiosis, this can lead to a compromised elimination of estrogen. I think I said that earlier. Gold star Jackie. And more. Another possible cause of endometriosis is viral and parasites. Now, I didn't know a lot about that, so that's interesting to me. It's driven by estrogen, but not caused by estrogen or estrogen dominance immune-related condition. Support the estrogen clearance, support liver phase 2 methylation. I was meant to change that to liver and I didn't. Support methylation. Explore the link between gluten and endometriosis. Consider going gluten-free, because we know our bodies aren't great with gluten, and it can mess our guts up. You know, think about going A1 casein-free. Consider nickel sensitivity and a low histamine diet. Maybe address gynecological infections, vaginal microbiome test to address vaginal health. Optimize progesterone, address stress, cortisol, emotional health, and there's some additional supplements, NAC, PEA, omega-3, and magnesium. There's no cure, as I said before, but it is possible to be pain-free, and there are solutions to reduce symptoms. Thank you very much, Marta, for all of those, and I know you're on standby. Other supplements and suggestions. Some of us can't absorb folic acid, so we have to have methylfolate. I personally just advise people to take methylfolate because I think it's easier. CoQ10 improves ovarian response and egg quality. Back to a good multivitamin. If you're needing extra bits, the one you take may not be enough, so you may need extras. We, as Chinese medicine, will always promote red meat for blood loss, because we want to get that, nourish the blood back into the body. However, you can do bone broth, you can take organ meat supplements, you can take Flora Vital or Flora, it's got another word, there's a gluten-free one, Flora Vital, Flora, whatever it is. So there are ways of getting this, but you do need to try and naturally replace what you've lost with that blood, because endometriosis is a heavy bleeding thing. And then you can do the Dutch test, which you can do through Marta. And there may be other people on the call that you can do that through, but I know Marta does the Dutch test and will read through it and look after you, which is what you want, which is all about your hormones. And it tests your urine over, I think it's 10 days. Okay. So holistic care is the care of the whole person. This is not a specific remedy or therapy. This is about looking at the whole person in front of you. Even if you're speaking to 20 endometriosis sufferers, they will have a slightly different story, but a same theme. Please listen to them and their story. Please try and hold them when they tell you. And when they tell you about the pain they've been through, they really have been through masses of pain and the adenomyosis. So we are looking at the holistic care. The Zanzino health protocol and the extra bits may not be the entirety. For some people it is. For some people it ticks everything, but there's people it doesn't. So we're looking at what else we can offer on top of that. How can we be there and help these women live a normal life without this 2 to 3 days a month having to lie on a sofa in agony? That shouldn't happen. Not in this day and age. We should be really helping people. Okay, so this is a little bit about Zanzino. Zanzino is committed to providing a holistic approach to women's health through its products. Their commitment extends beyond simply offering supplements. It encompasses a dedication to quality, sustainability, and the well-being of individuals. Part of that is having us people, practitioners, partners, anyone, you know, who's part of the company who will listen and help you. We are here once you decide what journey you want to go on with us. Zanzino's Balance Oil is crafted to deliver high-quality omega-3, specifically EPA and DHA, essential to various aspects of women's health. Their products are designed to provide comprehensive support for women's health, addressing specific needs from reproductive years to menopause. Oh, that's it. This is me and Beth. I will stop sharing in a minute. Quarter of an hour for questions, which is fantastic, and for Marta to speak too. So this is us if you ever need to find us, but I will take that away now, because just in case we have people who have questions. So there we go. I will stop the share.
Thank you, Jackie. That was amazing. Learned a lot today. Anybody got any questions?
I have a question.
Uh-huh.
I was just wondering, I was put on the mini pill, so basically I will not have a period. That was what I was told to do by the doctor for my endometriosis. So I want to try something more natural like Zanzino. So is it okay to take alongside that as well?
Yes.
Okay, cool.
Yes. What I would say is, don't just stop. Just come off that. I'm going to pull Marta in for this as well in a second, but yes, do it alongside it, because what you want to do is you want to be reducing inflammation, but I want Marta's input in what the pill will be doing while you're doing that. So what would your advice be, Marta?
Hi, Freya. So in terms of the pill, so obviously it's synthetic hormones and stops natural production of hormones. So it's just masking the symptoms. It's not dealing with the root cause of endometriosis, which could be in the gut. It could be inflammation, as Jackie mentioned. So it just could be something to do with the vaginal microbiome. So it's, once you're on the pill, you can still do all those tests. You could do Dutch, you can do Zanzino balance test, you can do vaginal test, just to find what may be driving the symptoms. And obviously you don't want to come off the pill and be in pain. You just really want to find the drivers first. And then once you reduce inflammation, once you put the nutrients in your body needs, once you balance your microbiome, then you can try to come off the pill.
Yeah. And will the pill be making a massive difference in that time?
It suppresses the pain, because it's just synthetic progestin, and it's suppressing the natural hormones. So it's kind of, GPs will prescribe the pill to suppress the pain or to deal with the symptoms, but it's not dealing with the root cause. It's just masking the symptoms. It's still there. It's just just finding what drives it.
Yeah, so basically the idea would be is which I would say in my clinic is start the healthy route, investigate, find out what's going on, and when you found that root cause and you're starting to heal and treat that, you can then think about taking that pill away. And
some women still have pain on the pill. It just really depends. Some women have pain after menopause, so it just and sometimes endometriosis is mistaken for IBS because it can present as IBS.
Yeah, I've had postmenopause. I did have some endometriosis pain because of HRT. So I was on it. Funny enough, when I finally got my cells right, I was able to bring my HRT right down because obviously my cells are absorbing more, and I've not had any of that since. So I think you have to be very careful when you're taking HRT as well with endometriosis.
Because estrogen can be, it's not the cause, but it's the driver. So we need to make sure the clearance of estrogen is efficient. So always talking gut health. That's one way. There's two phases. The liver, it goes through the liver, 3 different phases, and then it goes through the gut as well. So the gut has to be like in optimal health, because it's one way of getting rid of this estrogen. It's not that estrogen is bad, it just once it's used, it has to come out. And if you don't go to the toilet every day, you just reabsorb. And it's links to the microbiome as well. You can test microbiome. It tells you if there is specific bacteria that kind of unpacks that estrogen, so you reabsorb it. So gut absolutely essential when it comes to hormonal health. And it's obviously linked very close to the immune system. And then it's that overactive immune that's one of the main driver when it comes to endo and the pain, and your body is kind of like, it's not autoimmune condition, but it can present as autoimmune condition.
Okay, so we have Louise Goodman. She's asking, what's the best way to improve the microbiome?
So tests, ideally, if you can't test, do the one of those 360, they call it 360 GI tests, or just putting basics in, like probiotic rich foods, and put prebiotics to feed the good bacteria, removing the alcohol, the sugars, the inflammatory foods, a lot fiber as well, just whole foods, natural, no artificial sweeteners, just having quite like really clean diets with lots of diversity, like mushrooms and phytoestrogens and polyphenols. But tests will tell you if there's anything overgrowing, if there's any fungus, if there is any infections, if there is any permeability. So it's I love tests because I can see what's happening straight away. If somebody, it's quite a pricey test, the stool test. If somebody cannot afford it, then we just do the basics. Look at the diet first, look at the symptoms. Stress can drive the gut symptoms as well. So it's such a complex thing. It's never just, it may not be in the gut. It may be that the cortisol and the stress drives the gut symptoms. It may be that there is not enough specific bacteria that we can only see from the test if we test. Depends what other symptoms as well you have in terms of digestive symptoms.
How do you improve vaginal microbes?
Again, it depends what bacteria, what specific strains are there. I'm happy to, I have a handout. I can send it to anybody who needs it in terms of vaginal health, what can be done. And again, not overwashing, not using synthetic stuff. There's lots of things that kind of like contain artificial, like, I don't know, scents, and it's if anybody needs a handout, I'll send it out because it's quite a few things on it. Tampons as well, using like organic pads. So it's just, try not to disturb that microbiome.
Yeah, don't use anything with chemicals inside your body.
Yeah, and most of the pads and most of the tampons will have, they're not natural, they bleached, are they? So there's lots of natural stuff out there, and those moon cups, and I'm not sure what are they called moon cup?
Yeah, moon cups.
Yeah.
Chinese medicine, we're very against any tampon, because blood should flow out of the body, and you're stopping blood in the body where it shouldn't be stopped. So from our point of view, that's an issue. we actually say please use pads or moon cups.
And again, it's closely linked to gut health. So like pre and probiotics and lactobacillus bacteria like kefirs and those type of foods as well can help.
So
But again,
the biotic is great. If people haven't got the access and can't grab that food, then just have your scoops of xenobiotic. Tick. You're getting.
yeah, and obviously sugar can drive yeast infections, candida. So like sugar is like big trigger for vaginal infections, as well as alcohol. So just looking again, test if you can. If not, it just again stripping to whole foods. And
She keeps mentioning alcohol. I'm feeling a bit alcohol attacked here.
but it's the estrogen goes through the liver, and once like liver will prioritize, you will detoxify alcohol first and then hormone. It's a priority to detoxify toxin, not to detoxify hormones. So like, yeah, I understand it's relaxing, and a lot of women do drink some daily, and then that liver has to work much harder. And
do you know, I think that's really important to reiterate. So basically, for anyone interested, the liver will detox alcohol first because it's a toxin and more of a threat. And then the hormones that really are the things that need detoxing won't be done, and they'll go back into the body. Yay. I just wanted to make sure everything.
I'm not saying like nobody can have a glass of wine. It just depends how much alcohol, how often, and how healthy the liver is. Liver needs specific nutrients as well to like detoxify things. So B vitamins, folate, B12, it needs zinc, selenium, magnesium. It needs a good protein as well. And so many of us not eating enough protein from foods, not from like protein Weetabix or protein something in a bottle, made in a bottle. So just real foods.
Yeah. Nicola, I just saw she said about, sorry, the xenobiotic is a prebiotic. If I said probiotic, I'm sorry.
There are specific probiotics to clear estrogen. So there's a specific one that can help with that clearance. And then you have to put prebiotic on the top, ideally, to feed the beneficial bacteria, because we all have good and bad. And you can crowd out the bad bacteria. But probiotics can be very helpful. There is one for vaginal health. There's one for clearing the estrogen. There's just so many options, and they can be beneficial. But you need both pre and pro.
Zinzino don't do a probiotic, Nicola's asked. But
no, they don't.
No, but there's probiotic foods, and if you go to a good nutritionist like Marta, or you go to a functional medicine doctor, or you go to you will be able to get help and guidance with that. Don't just wander off and buy one from, I'm not going to name a shop, but don't just wander off and buy one from willy-nilly from a shop without getting some good.
When it comes to probiotics, I use In Vivo Lab, because they do the testing, and they can match one with the results, or they're just like, it's a really good brand, and supplements are excellent. And there's lots of the UI infection, urine infection as well. They have loads, and it's and they do vaginal microbiome tests, stool testing, oral tests as well, oral microbiome. So they are really good. And then obviously whatever is the issue, they can help to support it. And then prebiotics as well.
You can tell the scientists are like big on these microbiomes now, aren't they? It's like the one in the mouth, the one in the vagina, the one in the gut.
Yeah, we covered in it. Skin. Like there's no test for the skin. They don't do that, but yeah, it's all over us.
Louise Goodman, your question's not clear. Do you want to unmute yourself and ask estrogen? Is that the name of a probiotic, or what's your question there? No.
Has she gone?
No, she's there, but.
What's the probiotic for estrogen?
Okay.
If you go on In Vivo website, there is one. I can't remember what it's called now. Estro something. They have it's quite a small range, but it tells you which one is for that clearance to help the.
What's the name of the company, just to be clear? In Vivo.
I put it in the chat. I'll put it in the chat.
Yeah,
In Vivo.
put it in the chat.
Where's the chat?
We're
can't
doing
see the
pretty
chat.
good for timing. I'm quite impressed with the timing. We've done good.
I can't see the chat on my screen. Where is it?
Oh, if you tell me how to spell it, I can put it in.
INVIVI.
INVIVO.
Is it right? NVO.
Oh, it's just changed it to invite.
INVIVO, and then you can go shop, and it's just lists all the probiotics,
In vivo. Okay.
Invivo.
Does
and
anybody
then all the testing as well. They do all the tests.
anybody else got any questions? No?
Oh,
Okay. That was brilliant. Thank you so much. Marta, thank you so much for coming on board and answering those questions. That was very, very informative. Thank you.
My pleasure.
yeah. Thank you, Marta, for being my little backup there.
It's really good. Thank you.
I just think none of us can have all the knowledge, so we've just got to be there for each other to share the knowledge, haven't we?
Absolutely. Women supporting women. That's what I love.
Yeah.
Exactly.
Absolutely. Well, thank you very much for having me.
Thank you. Bye.